Good afternoon, everyone, and welcome to today's webinar. My name is Michaela Holm, and I work with Kaufman and Associates, and I'll be your moderator for today. Before we begin, I'd like to highlight the main features of your Zoom webinar interface. First, the presentation slides are at the main window, and the speakers will appear at the top just above the presentation. At the bottom of your screen is the Zoom menu bar. Here you'll find the Q&A box. We encourage you to use this feature to submit any questions at any point during the webinar. And if we have time at the end, we'll address those questions as well. At the bottom of your menu bar, you'll also find a chat box. Please use the chat box to report any technical issues you may be experiencing. We'll respond to those concerns as they come in. Additionally, live captioning is available during today's broadcast. Simply click the CC icon from your bottom menu bar and use this feature. And then finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future at go.cms.gov/AIAN. And at this time, I'd like to turn it over to Kitty Marks.
Thank you, Michaela. Good afternoon. I am Kitty Marks, Director of the Division of Tribal Affairs at CMS, and welcome you to today's All Tribes Call consultation. On November 4th, CMS issued an interim final rule with comment period, otherwise known as an IFC, that requires COVID-19 vaccination of applicable staff at Medicare and Medicaid certified healthcare facilities. Consistent with CMS's tribal consultation policy, CMS held an All Tribes consultation webinar on November 18th to provide an overview of the IFC and hear comments and questions from tribal participants. The IFC had a comment period that ended January 4th, 2022, and we did receive comments from tribal organizations, and we are currently reviewing those comments. We appreciate that feedback. Today, we are holding a follow-up All Tribes Call consultation in collaboration with the CMS Center for Clinical Standards and Quality to explain how your health facilities can utilize the CMS Quality Certification and Oversights Report. We call that QCOR. It's a website where you can search for CMS certification numbers of facilities subject to the IFC. Joining me on today's call is Wendy Hilt on detail with the Division of Tribal Affairs and our colleagues at CCSQ, Lisa Parker, Lauren Oviatt, Adam Richards, and David Wright. One of the main concerns that we heard from the tribal participants on the November 18th call was the question on whether a particular tribal operated facility was covered by the IFC. We explained on the call that there is a QCOR website where a facility can type in the name of their facility and location to determine its CMS certification number, otherwise known as CCNs. The Division of Tribal Affairs has compared a list of IHS and tribal facilities that are found on the IHS.gov website with the facilities on the QCOR website. We will be posting this list on the spotlight page of the American Indian Alaska Native website at go.cms.gov/AIAN. We have also shared this list with the CMS Tribal Technical Advisory Group and the National Indian Health Board. Based on our analysis, there are approximately 42 IHS and tribal hospitals with CCNs, approximately 100 tribal Medicare FQHCs with CCNs, and several miscellaneous tribal Medicare and Medicaid certified facilities. As we will explain on today's call, if your facility does not have a CCN or a lab-only CCN, your facility is not covered by the IFC. We thought it would be helpful for us to walk through the QCOR site and explain how it works. We are available to answer any questions you might have about the QCOR site and the list of IHS tribal facilities who are covered by the IFC. In addition, we have prepared responses to additional questions we received from tribal providers, and we will walk through those QAs as well. So Wendy, let me go ahead and turn the presentation over to you, and you can walk through the QCOR site. Thank you.
Thanks so much, Kitty. Next slide. It's important to know that what facilities fall under this regulation. This slide lists all the facility types that fall under the COVID-19 healthcare staff vaccination interim rule. I know this is a long list, so please note this presentation will be available after the call. Next slide. By far, the question Tribal Affairs was most often asked after the November 18th call was, how do I know if my facility is a Medicare certified facility? Next slide. Thankfully, we have an easy answer. It's QCOR. QCOR is an online reporting system of providers and suppliers for Medicare and Medicaid services. You can visit QCOR at https://QCOR.cms.gov. Next slide. Once you are on the home page of QCOR, you want to look to the top left of the screen, and then you want to click on the text Basic Search. Next slide. After clicking on Basic Search, a new screen will open. Here you will have several options to search for your facility. Those include part or all of your facility name, the CMS certification number, state, city, or zip code. Once you enter one or more of the criteria, then you would go ahead and click the search button. Next slide. For the purpose of this presentation, I simply looked under the word Chickasaw in the provider name field. As you can see, by searching under that one word, we have several results. One ESRD facility, one home health facility, one hospital, and several labs. As Kitty stated, please note, laboratories with a CMS certification number, but not located within a certified facility, such as a hospital, would not fall under this requirement. Next slide. If you want to get more details on a specific facility, simply click on the facility's name. Once you do, a pop-up window will appear with the facility's details, including the CMS certification number, or CCN, the phone number, and the address. Next slide. Another question we received is, does this requirement apply to Indian Health Services, tribal health programs, and urban Indian organizations? Generally, yes. IHS, THP, and UIO facilities that are regulated under the COPs must comply with the rule. Therefore, the staff vaccination requirement outlined within this regulation applies. IHS, THP, and UIO facilities that are not certified as one of the provider types are outside of the scope of the rule. For example, tribal clinics that are enrolled only in Medicare Part B or only enrolled in Medicaid are outside of the scope of this rule. In addition, tribal FQHCs that do not participate in Medicare, but only in Medicaid, are not subject to these requirements either. Next slide. We also got asked, are residential assisted living facilities receiving Medicaid or Medicare funds subject to the requirement? The simple answer is no. This regulation only applies to Medicare and Medicaid certified facilities. Since CMS does not have regulatory authority over care settings such as assisted living facilities or group homes, this regulation does not apply. We would also like to note that this regulation will not apply to physician offices because they are not subject to CMS health and safety regulations. Next slide. Does this requirement apply to visitors to the facility? Facilities are required to have a process or policy in place ensuring that all applicable staff are vaccinated against COVID-19, including contractors that visit the facility on a regular basis. This requirement does not apply to visitors, such as family members or friends. Facilities are not required to ensure vaccination of vendors, volunteers, or professionals who infrequently provide ad hoc non-healthcare services, such as an annual elevator inspection, or services that are performed exclusively off-site and not at or adjacent to any site of the patient care. Please emphasize the frequency. For example, on the November call, we were asked whether the requirements apply to tribal council members who might visit the facility. If a tribal council member attends frequent meetings in the facility, they could fall under this requirement, especially if they are using common areas used by staff, patients, and visitors. Next slide. Are tribal Medicare and Medicaid certified facilities required to provide exemptions to the vaccine or other requirements of the interim final rule as a reasonable medical accommodation for disability under the Americans with Disability Act or religious accommodation under Title VII of the Civil Rights Act? Although we understand that tribes are excluded from the definition of employer under the ADA and Title VII of the Civil Rights Act, certain allergies, recognized medical conditions, or religious beliefs, observances, or practices may provide grounds for exemption. Each covered facility should establish exemptions as part of its policies and procedures to ensure that such exemptions align with federal law. Next slide. An important question is, of course, when and how will enforcement of this rule begin? Next slide. This rule will be rolled out in 2 phases. Phase 1 will be ensuring your staff begins the vaccination process, including how your facility tracks employee vaccination and your facility's policy on exemptions. Then there's phase 2, which is the date you must have your staff fully vaccinated by. Next slide. The due dates for these phases are based on your location. If your facility is located in a state listed on this slide, then phase 1's implementation date was January 27th, and your phase 2 implementation date is February 28th. Next slide. If your facility is listed in the states on the top section of this slide, then phase 1's implementation date is February 14th, and your phase 2 implementation date is March 15th. And if your facility is in Texas, then phase 1 implementation is on February 22nd, and your phase 2 implementation date is March 21st. Next slide. So, what is fully vaccinated? For purposes of this regulation, CMS currently considers staff fully vaccinated if it has been 2 weeks or more since they completed all required doses of the initial vaccination. However, staff who have completed the initial vaccination by phase 2 implementation date are considered to have met these requirements, even if they have not yet completed the 14-day waiting period required for full vaccination. Also, please note booster shots are not required as part of this regulation. Next slide. To meet this requirement, your facility must have a process or plan in place for documenting and tracking staff vaccination. This includes appropriately documenting all COVID-19 vaccinations. Please note you must keep all medical records, including vaccination documentation, confidential and stored separately from an employer's personnel file. The acceptable forms of proof of vaccination include CDC COVID-19 vaccination record, documentation of vaccination from a healthcare provider or electronic health record, or state immunization information system of record. Ultimately, it is up to you to ensure that you have a process or plan in place for capturing COVID-19 vaccination status for all staff, including individuals who provide services under contract or other arrangements. Next slide. To enforce these requirements, CMS works directly with the state survey agencies and federal surveyors in the regional offices to regularly review compliance with Medicare, Medicaid regulations across multiple healthcare settings. While on site, the surveyors will review the facility's COVID-19 vaccination policies and procedures, the number of residents and staff COVID-19 cases over the last 4 weeks, the facility's list of all staff and their vaccination status. CMS will use this information in addition to interviews and observations to determine your compliance with these requirements. Additionally, accrediting organizations will be required to update their survey process to assess facilities they accredit for compliance with vaccination regulations. Next slide. It is important to note that there can be penalties if your facility doesn't meet these requirements. For nursing homes, home health agencies, and hospice, this includes civil monetary penalties, denial of payment, and even termination from the Medicare and Medicaid programs as a final measure. Noncompliance among hospitals and certain other acute continuing care providers is termination. Next slide. Please know that CMS has a variety of resources to help you during the rollout. This slide has links to the QCOR, today's presentation, and more. I would like to note that we on the Tribal Affairs team also have a resource box if you have any questions or need assistance. You can always email us at tribalaffairs@cms.hhs.gov. Next slide. Thanks so much for listening during this presentation. I hope it helped to clarify some issues and answer some questions. I will now turn it over to Michaela in case we have time for some questions and answers. Michaela?
Hi, everyone. At this time, you can please state your questions in the Q&A, and then I will read them off. So our first question that we have is, you say that federal law says Title 7 of the Civil Rights Act does not apply to tribes. Then you state that religious beliefs may provide grounds for an exemption. Then you state tribes should consider policies in line with federal law. Can you confirm a tribe that declines to include religious exemptions because of Title 7 is inapplicable, is in line with federal law?
Well, this is Kitty Marks, and I'll try to answer that. And if there are others on our CCSQ staff that might be able to help, it's my understanding that there are other provisions in federal law that might require a medical or religious exemption. So what we're indicating and what the regulations indicate is tribes should consider establishing exemptions. And then, you know, if you are planning on providing exemptions for medical or religious reasons, to have a process in place for, processing those requests. So, thank you.
All right, our next question is, CMS continues to state generally, yes, IHS, THP, and UIO facilities are regulated under COPS, must comply with the rule. This statement is causing a lot of confusion for tribal attorneys, staff, and contradicts the rule that your statement on the slides that there are many IHS, THP, and UIO facilities that are not covered by the rule. Will CMS please revise the statement to mirror the language in the rule?
Again, I can try to answer that, but I encourage the CCSQ staff to weigh in. What the slide and I think what the regulations do indicate that if a facility is governed by conditions of participation, such as the Medicare certified and the Medicaid certified facilities, then the rule applies. However, there are several types of facilities that are operated by IHS and tribes that fall outside of the rule. And that's what we showed in the slide deck earlier on in the presentation. Our office did an extensive analysis of the IHS tribal health facilities that are located on ihs.gov. We compared those facilities with the facilities listed in the QCOR site. We can share that list of facilities, but this document was put together for informational purposes only. So I encourage everyone on the phone, if you're not sure whether you have a Medicare certification number, then please utilize that QCOR site. As we've also indicated that if you are a lab with a CCN number and not located within a hospital that would have a certification number, then you're not covered by the rule. Let me pause and see if there's any other comments from the CCSQ staff on that point. Okay, and if you have any questions about whether your facility is covered by the IFC, we encourage you to go to our website, and maybe we can go back to the previous screen where we are listing several links, including our Tribal Affairs website. So here's the link to the QCOR where you can type in the name of your facilities to see if you have a CCN number. And then the list of tribal and IHS facilities that we compiled for informational purposes is on our spotlight page. And I think there were some other questions about whether the PowerPoint presentation will be available, and that will be posted on our website page as well. Thank you.
Thank you. And then just a reminder to type those questions in the Q&A box at this time so we can get those answered. The next question is, will the implementation dates be altered for tribes due to tribal consultation is just happening now?
No, we will not be adjusting the timelines that were outlined in the PowerPoint presentation and that are also found on cms.gov at the CMS FAQs where the link is. Consistent with our CMS tribal consultation policy, we're not always able to consult prior to publication of a proposed rule. And that's why our tribal consultation policy outlines a process for us to hold all tribes calls consultation after publication of a proposed rule and prior to the date of submission for comments. As many of you know, President Biden issued a White House executive order requiring agencies to reevaluate its tribal consultation policy, and CMS, in conjunction with HHS, will be reevaluating our CMS tribal consultation policy in the next year. And we can certainly discuss this issue that seems to be raised through this question of changing implementation dates for particular rules or any other issues that you might want to discuss regarding our consultation policy and how it could be changed to be more effective for tribal governments. That's what our main interest is. We appreciate your question. Thank you.
Great. The next question I have is, For FQHCs, are providers who have been granted an exemption permitted to provide direct care as long as they wear, for example, N95 masks?
Hi, yes, providers who have been granted an exemption, a medical or religious exemption in accordance with the requirements and the policies and procedures set up by the provider would be able to provide care, and it would be on the provider to establish policies and procedures to mitigate transmission of COVID-19, such as N95 masks.
Great. The next question is a tribal health clinic that is listed in QCOR as a FQHC has a CMS certification number. Is that health clinic is subject to a vaccination mandate?
I believe they would be if they have a certification number and they have been identified in QCOR as a CMS certified provider, then yes.
And just thank you, Lisa. And just to be clear, it's the Medicare tribal FQHCs that have a CCN number. So if you're a tribe that only operates as a Medicaid FQHC, you are not covered by this rule.
Next question is it allowable for CMS certified facility employees to work in a building outside of the health center in another building and not be vaccinated with COVID-19 vaccine, as long as they do not enter the facility or interact face-to-face with patients, for example, the billing department?
Yes, they can. Individuals who work outside of the facility and do not come in contact with staff that carry on patient care activities or with patients would not need to be vaccinated. For example, like a billing department, like you mentioned.
Okay. Are tribes allowed to request a booster shot for employees, for example, to have stricter vaccination policies?
Our regulation does not prohibit facilities from establishing policies and procedures that are more strict than the requirements set forth in the regulations.
Right. Next question is failing to consult as required and then failing to modify your enforcement to account for that failure, especially in light of the federal trust responsibility you carry. The tribal consultation requirements are over 20 years old.
Well, thank you for that question. I'm not sure who that's from, anonymous participant, but our CMS tribal consultation policy and the HHS tribal consultation policy does not require us to waive deliberative process, and that's what sometimes happens during the promulgation of regulations. To the extent that CMS can conduct consultation that does not result in waiving our deliberative process, we do that. And we find it helpful, frankly, when we hold consultations after publication of a proposed rule so that we can explain the proposed rule, provide any questions or provide any answers to questions that might be raised, and then to help address them. And the Division of Tribal Affairs is here to address any technical assistance questions you might have as the rule is implemented at your particular facility. Thank you.
Next question, Lisa, this is a follow-up one similar to a previous question, but are the billing departments required to get vaccines since they don't offer patient care?
So in accordance with the regulations, staff who provide support services that are performed exclusively outside of the facility setting and who do not have any direct contact with patients or other healthcare workers would not need to be vaccinated. So it really depends on the location of the billing department and the extent to which they interact with those providing patient care and patients.
Next question is, what is the penalty for facilities who have employees who refuse the COVID-19 vaccine if they are allowed to continue to work in the CMS certified facility, even wearing the appropriate PPE?
Yeah, this is David Wright with CMS. There's a couple of aspects of that question to clarify. One is that our expectation is staff under this requirement are either vaccinated or they've received from the facility an exception. So this question seems to contemplate that they don't have an exception. And if they don't, then our expectation is that the facility will either move that employee or redefine their work duties so that they don't come into contact with patients, or succeed in getting that individual vaccinated, or again, provide a recognized exception to them. The penalties generally for non-compliance, this is one of the conditions of participation or requirements or conditions for coverage that all providers have to meet. The ultimate sanction that CMS has is to terminate federal funding to that facility, the Medicare and Medicaid reimbursement. However, we're a compliance program, so anytime we identify non-compliance, we are going to give the facility an opportunity to come into compliance, and there'll be a period of time before any definitive action is taken. We also recognize, just to point out, that facilities can be making good faith efforts to come into and maintain compliance with this requirement, and we recognize those as well.
Okay, next question is, what about regular vendors like linen supplies or pharmacy deliveries? We don't control who comes for those suppliers.
Right. So I think we are providing a written answer on that question, but the facility would need to address this in their policies and procedures. And the rule does require that individuals or entities that have a contractual relationship with the facility would need to be vaccinated. So again, it depends on frequency, it depends on patient contact, and we will be looking at the facility's policies and procedures around those issues.
All right, next question. If your tribally operated facility and your facility name shows in the QCOR with a provider or supplier type as laboratory, reaffirm that the IFC vaccination mandate does not apply. Furthermore, showing exemption status as yes, this type of facility would not have to comply.
So yeah, to reinforce this, David, again, the vaccination requirement attaches to the conditions of participation. Laboratories that operate under a CLIA certification, the Clinical Laboratory Improvements Act, that's a different statute, and there is not a vaccination requirement that attaches to the Clinical Laboratory Improvements Act. So if the only certification an entity holds from us is a CLIA lab certificate, then that in and of itself would not obligate that facility to follow the vaccination mandate. So the lab only certification, if that's the only certification you have from us, that is not impacted by this requirement.
Next question is, may I ask if tribes are required to perform COVID-19 tests of employees who filed religious or medical exemption form?
No, the rule does not require testing, but it does require facilities to take steps to mitigate the spread of COVID-19 for individuals who are not vaccinated. And so testing could be a part of a facility's procedures for that. It could be masking or other steps that a facility would take to ensure that COVID-19 is not spread unnecessarily.
And just a reminder to put your questions in the Q&A box instead of the chat box. That way we can answer them. The next question is, are there federal guidelines for determining medical and religious exemptions, or is that left to the provider?
So we do encourage providers in the preamble of the interim final rule to review the Equal Employment Opportunity Commission's compliance manual on religious discrimination for more information about religious exemptions.
Will CMS provide sample policy and procedures?
I was going to go ahead, Lisa. This is David. No, we do not generally provide sample policies and procedures for any of our requirements. We do have the interpretive guidance that's available online, and we can make sure that that link is available to you all as well. That outlines our expectations and what the surveyors will be looking for with regard to compliance. But because of the breadth of providers and their different sizes and operations, it would really be impossible for us to provide a model policy and procedure, but we do outline our expectations of what policies and procedures should do in the guidance that we've provided.
Next question is, when will the interim final rule expire, and will compliance surveys and the risk of compliance penalties end?
So I'll answer the first part. The rule, unless we take action beforehand, the rule will be in effect for 3 years from the date of publication. So I believe it published in November of last year. So it would be in effect for 3 years after that, barring any additional regulatory action from CMS.
And the surveys and the penalties attached to any noncompliance, the authority is derived from the rule. So while that's in effect, then the surveys and the enforcement will be in effect as well.
The next question is, we were advised by our employment law attorney that wearing an N95 mask as a religious exemption was not enough for patient care positions. We are currently requiring N95 and weekly testing, but was told patient care positions must receive a vaccine or work remotely or only see patients who are non-immunocompromised and vaccinated patients. Could you please confirm?
So I'll say that the regulation does not specify exactly what facilities would need to do to mitigate the spread of COVID-19 for those individuals who are not vaccinated. We do require a contingency plan and policies and procedures, and those things would be evaluated on survey.
Next question is, our fire department has a COP with a non-tribal hospital. They are not listed in QCOR. Are they required to follow the vaccination mandate?
Yeah, this, David, I don't know, might be a different use of the term COP, but generally a fire department wouldn't qualify as one of the provider supplier types that we generally oversee. So and if they're not listed in QCOR, then that's more confirmation that they would not be required to follow this requirement.
The 638 tribal health program that has an on-site pharmacy and bills Medicare Part B and Part D, does that THP need to comply with the CMS vaccine mandate?
I wonder if, Kitty, are you familiar with this particular type of program?
Right. Well, this is a 638 tribal program, which means it's operated under the Indian Self-Determination Act through contracts or compacts with IHS. But it sounds like they have only an on-site pharmacy, and then they only bill Part B. So we can certainly take this question back, but if they're only billing Part B, then they're probably enrolled in Medicare as a physician's office, and then perhaps have contracts under Part D, which is the Medicare outpatient prescription drug program. So I don't know, David, if you can answer that, or we can certainly take that question back.
Again, I think, what we want to reinforce is that it's about how the entity is certified, not necessarily how they bill, but it doesn't sound like that this pharmacy, just by the way the question is written, would indicate that this would be an entity that we'd certify and therefore fall under the requirement.
Thank you.
Tribal nations should not be mandated to follow this as we have very limited workforce. This has caused significant hardship to the healthcare we can deliver, especially in rural tribal nations. We should have the flexibility to make this decision as a sovereign nation. This is why consultation should have been completed first. This does not work for the tribes and has major impacts.
Well, this is Kitty again, and I think we've addressed this question. There is not an exemption for tribally operated facilities in the regulation. The regulation applies to all Medicare certified facilities. Like I said, if we want to talk about consultation, we can do that in the context of the CMS tribal consultation policy, but we appreciate your comment. Thank you.
A tribally operated facility contains an FQHC and other services such as dental services. Are the additional services like dental required to be vaccinated because they share the same building?
So I think it depends on how the services are set up. If there's a tribal building with separate services and separate offices and maybe a shared lobby, then the services that aren't Medicare certified providers would not need to be vaccinated. But if there are cases where there's a clinic and individuals come into the clinic to provide services, then anyone who enters into the Medicare certified facility and has contact with patients and individuals who provide patient care, those individuals would need to be vaccinated.
The next question is, a determination of the sincerity of a request for religious exemption is highly subjective. Would a facility's policy of simply expecting all requests for religious exemptions be considered a valid policy?
I would say that we would expect a facility to have some method of evaluating those requests and making determinations on those requests in line with the EEOC guidance that we cite in the regulation.
Thank you, Lisa. And we can send out a link to that EEOC guidance too and post that on the American Indian Alaska Native webpage. I don't have that citation right in front of me.
And this is just a reminder to type those questions in the Q&A box at this time, and then we can answer those questions verbally. I do see, oh, here is another question. Is there any considerations for tribal development of specific indigenous medical or religious exemptions?
I'm sorry, I don't understand that question. Maybe Kitty, you can opine on that.
Yeah, I'm trying to understand the question as well. There are certain, I know, particular Indian religions, so I don't know if that's what they're referring to, but again, maybe the EEOC guidance might help there. As far as the medical exemption, I think that that's laid out in the regs as long in the FAQs, right? For any the process for staff seeking a medical exemption.
Yes.
And if there are any more questions, we suggest that you put them in the Q&A box at this time. We do have one hand up. And so Tom, if you could help unmute the line, we can have them answer their question verbally.
Apologies, that was an unintended raised hand. Sorry.
No worries, no worries. We do have another question in the Q&A. The question is, we are not Medicare certified, but our clinics show as FQHC on the QCOR. Are we exempt from the IFR?
Lisa, you can help me, but I think if you're certified by us, which is what would be reflected on QCOR, then our expectation is that you would be under the requirement.
Right. And they say they're not Medicare certified. So I think that the requirements would not apply.
Yeah, I just can't tell
Right.
why we'd have them if they weren't, but
Right. And again, this is Kitty Marks. We can, this again is anonymous attendee, but if you want to send your question in the name of your facilities to tribalaffairs@cms.hhs.gov, we can work to see whether there might be an error on the QCOR site or perhaps on the site. So we can straighten that out for you. Thank you.
And if you have any other questions, please place them in the Q&A box at this time. Our next question is a healthcare facility required to provide additional mitigation strategies that are currently being practiced for all staff, for those not vaccinated with approved medical exemption?
Yes, facilities are required to mitigate the spread of COVID-19 for those who have exemptions.
Okay, just a reminder, if you have any final questions, to put them in the Q&A box. The next question is, if your facility is already following all CDC mitigation strategies, do unvaccinated folks need additional mitigation strategies that only apply to them?
So as I noted before, the regulation is not specific about the types of mitigation strategies that need to be applied. We would certainly recommend that you follow the CDC recommendations, but other than that, the regulation is not specific in that regard.
If there are any other questions, you can place them in the Q&A box. If the facility is in phase 1, does that mean that employees not vaccinated by 2/14/22 with at least one dose of the second dosed COVID-19? Sorry, let me start that over. If the facility is in phase 1, does that mean that employees not vaccinated by 2/14/22 with at least one dose of the 2-dose COVID vaccine should no longer be allowed to work in the facility?
No. So employees are allowed to work once they have one vaccine. They're allowed to provide patient care. So it shouldn't be that if they're in the waiting period between the first and the second dose that they wouldn't be allowed to work.
If you have any other questions, please place them in the Q&A box at this time. I'm not seeing any additional questions come through at this time. Presenters, do you and the panelists have any closing remarks?
Thanks, Michaela. I will go ahead. I don't know whether Lisa or David, you want to say anything as part of your closing remarks, but I appreciate you being on today's call. And I want to thank all the participants for being on today's call. I hope you found it helpful. And as I've indicated many times, our office is available to provide any technical assistance questions you might have. Again, our mailbox is tribalaffairs@cms.hhs.gov, and we can answer any questions you might have, help you with your finding your facility on the QCOR site or not. And we are available to continue our conversation regarding some of the consultation issues that were raised on the call today. So are there any other questions, Michaela? I think maybe one came in. Okay.
We have one question left that just came through, and it says, what about if the employees has no vaccinations by 2/14/22?
So in accordance with one of the slides that Wendy shared earlier, there was a deadline for phase one where an employee would need to be vaccinated with at least the first shot by phase one of a 2-dose vaccine, and then the second shot by phase two. So a facility needs to have contingency plans for employees who are not vaccinated, either via an exemption or those who refuse vaccination.
Okay.
There are no
Thank you.
other questions in the Q&A box.
Okay. Well, why don't we go ahead and close the call? Again, I want to thank all the participants and thank you for submitting your questions. Again, I hope you found the presentation helpful, and thank you to Lisa and David for helping out with some of the questions and answering the questions. So again, thank you for your participation, and we'll go ahead and close the call and hope everyone has a great afternoon. Thank you.